Sponsored by InsureItForward. Well, finding the right fit when it comes to insurance coverage just got a little bit easier thanks to Jim Scheihing at InsureItForward. It's a local health insurance agency out of Edmond, and he is back with us today. Jim, so great to see you.
Great to be here.
Well, I know you've given us some really great information, especially over the last couple of weeks. So today we're going to talk a little bit about open enrollment or Obamacare. So what do we need to know exactly?
Well, the open enrollment season, it's crazy because we have both for over 65 and under. And today I'm going to kind of mainly focus on the under 65.
Okay.
So it started November 1st and it runs through December 15th if you want your coverage to start January 1. We're open extended hours, so it's a crazy time for us. We're open 7 days a week. We're open till 8 Monday through Thursday, so it's just crazy for us. But there's a lot of new plans this year. In most parts of Oklahoma, there's over 100 different plans to choose from.
Wow.
And the bronze plans, which is where most people start because they have the cheapest prices, they're starting with $9,100 deductibles. So we're having to do quite a bit to try to figure that out, and we found some other things because most people can't afford that. So maybe they can't afford a silver, but they can't afford the bronze either. So we found some other things to kind of help offset that.
Yeah, I bet you know how to get creative to find the right plan. You have to. Really.
Yeah, we've really had to sit with the Affordable Care Act because it just changed everything. It's hard to believe it's 10 years already.
Oh gosh. Now, if someone is already on the marketplace, do they have to re-enroll for this type of coverage, or are they automatically on it? How's that?
So if you're happy with the plan you're on, they will automatically stay on that current plan.
Okay.
Now this year we have Bright Health that left the market, Bright Health that left the market. So if you're with Bright Health, you'll need to find a plan that fits your needs this year. And the markets have changed a lot this year, so it's always a good idea to shop. Like, in the past, most of the insurance companies have had multiple hospital chains. This year, a lot of them just have one of the major hospital chains.
All right, so let's talk about plans a little bit. There are so many out there, and there's so many options. So do you have any suggestions on kind of how to narrow that down before maybe somebody contacts an insurance agent?
Yeah. We always like when people call us, and we're open extended hours, and we love to sit down and work with them and help them find a plan. But a lot of people kind of want to do some of that research beforehand. And we kind of have a saying around the office: friends don't let friends go to healthcare.ug alone. Because a lot of people get off onto weird sites and their phones blow up because they make them enter information to get quotes. If you go to InsureItForward, you don't have to give us any information. We don't ask for your phone number. We don't ask anything. All you have to do is put in your age, your zip code, and an estimate of income. You can put Fred Smith in there, whatever you want. Nobody's going to call you. If you do put your information, we may reach out once, but that's it. But if you don't want the calls, you don't want to get blown up, just don't put the information in. Then after you're done, you can either go and enroll yourself. If you go through our portal, instead of it taking like 30 minutes, it takes 10. Or you can call us and we'll help you kind of fine tune the plan and make sure you found the one that has your doctors, your hospitals, because after all, it's about taking care of your health and your family.
Right. Yeah. And not all plans are created equal. I learned last week with you talking about prescriptions. And you might be somebody who is prescription heavy, and so there are certain plans that can really be tailored to somebody who's going to, maximize those benefits as well. That's
right. Like most of the bronze plans, you have very little prescription drug coverage until after you meet your deductible. So that's one of the kind of things we're trying to figure out, because that is a big part of it, and most people don't want their prescriptions to not kick in until after $9,100.
Yeah.
Right.
So
for so many of these clients who kind of need their insurance to be finely tuned to their needs, you will meet the needs of these clients and kind of fit in with how much they can afford, what they actually need on their insurance coverage, and answer all of those hard-hitting questions.
Yeah, and we'd love to sit down and just help people find the right plan that has their doctors, their hospitals, and our fee. Let me try that again. We don't charge for our services. We're paid by the insurance companies, so there's no cost at all to our clients. Wow. We just like to help them find the right plan.
It's a win-win.
You genuinely do. Free help.
Yep,
I love that.
That's right. That's right.
All right, Jim. Well, thank you so much. Great information. Learning so much in these segments, so we sure appreciate it. This is part 3 of a 5-part series that we're doing, and we're excited about it. So we want to let you know if you can find out more information about InsureItForward health insurance agents with a cause. You can call them at 405-585-0648. You can also check them out online at InsureItForward.com.